All right, so let's talk about ChiroThin. ChiroThin is our in-office, doctor-supervised weight loss program. I mean, it's called a weight loss program because most people lose a lot of weight. Most women lose anywhere from 20 to 25 pounds just in 6 weeks. And most men, of course, men have it a lot easier than ladies do, and that is unfair, I know. But most men lose 30, 35, sometimes 40 pounds in 6 weeks. And it's not a crash diet, fad diet. The goal of it is to actually reset your metabolic set point. So it's essentially a metabolic reset. And it's to establish a new BMR, which is your basal metabolic rate. And your BMR is how many calories you burn every day simply doing nothing, just getting up, moving around throughout your day. Because most people are currently at what's called a set point. And your set point is essentially where you're at. And the way we explain this is most people will try to lose weight, they'll go on a new diet or they'll exercise, and they can only lose maybe 5 or 10 pounds, and then they just kind of get stuck. And then as soon as they stop dieting or stop exercising, the weight comes right back. So that's why you're at a current metabolic set point, and our goal is to reestablish a new one. And the program is very simple. It's 6 weeks. It's doctor supervised. It's real food. There's no fake food bars or, Weight Watchers type food that you get through the mail. It's all real stuff. And we give you the recipes and the shopping guide and the accountability tracker. And you come in once a week to weigh and do your measurements and check in with you and see if you have any questions. It's a really, really simple program. Most people do not have a lot of hunger. That's the biggest surprise for most folks is they're not hungry. And you would think, eating lesser calories and healthier food that I'm going to be starving. But the fact is, after the first couple of days, for most people, that's not a problem at all. And the goal is to reestablish the new set point. The real big thing, the reason it causes you to lose weight, and weight loss is really just a side effect, but the real benefit is that it decreases inflammation. And you guys know this, that inflammation not only causes excess weight gain, but it's also the driver of every chronic disease that we worry about, because inflammation leads to heart disease and to most cancers and to type 2 diabetes and obesity and allergies and arthritis and asthma and fibromyalgia. I mean, down the list. It's the driver of almost every disease that we worry about. So it downregulates inflammation, and it helps to reset insulin sensitivity. And that's a big one. Metabolic syndrome is rampant across this culture. And again, that leads into every chronic disease we worry about. And the program helps you to detoxify. So it's a full body, full cellular, whole body detox, not just liver, colon, pancreas, like kidneys. It's helping your entire body to detoxify. So ChiroThin, that's our program. We know it works. If you got questions, feel free to ask us, and I hope that helps.